Assalamualaikum and salam sejahtera everyone. So in this video, my group and I were going to present about chronic bowel disease. So let's get started. First of all, what is chronic bowel disease? So chronic bowel disease is also known as inflammatory bowel disease. It's a condition by which inflammation takes place at the bowel. So there are two main types of IBD. First of all is ulcerative colitis, by which inflammation or ulceration take place on a part or along the lining of rectum and colon. And the second one is Crohn's disease, by which inflammation take place on any part of the GIT from mouth to anus. So here's the difference between Crohn's disease and ulcerative disease. Ulcerative colitis in terms of site of infection, and the symptoms of IBD include diarrhea, abdominal pain, nausea, and vomiting. The risk factors include the genetic factors in terms of the presence of two copies of IBD1 genes. The second one is environmental factors in terms of smoking and infection, and the third one is individual factors in terms of the history of appendix removal and medication. So here's the list of drugs used for the treatment that we are going to discuss in this video. First drug is mesalamine. Mesalamine is a type of 5-amino-salicylic acid from the groups of anti-inflammatory drugs. It inhibits the production of inflammatory agents and allows the damaged tissues to heal. The entry route of administrations can be administered orally and can be administered rectally as well. So the mechanism of action by mesalamine. First, mesalamine will develop a topical type of effect on the target site, by which our colon. The administered mesalamine will be absorbed by the colonic epithelium. So mesalamine will enter the nucleus and activate the PPAR gamma. The activated PPAR gamma then will repress the genes that involve in the transcription of inflammatory proteins, thus reduce or inhibit the inflammation process.
I will present about the side effect and also precaution of the mesalamine. First of all, for the common side effect, a patient having a headache, abdominal pain, influenza, constipation, and also flatulence. And for the severe side effect, a patient having a severe stomach pain, having kidney disease, which is a problem in urination, and also liver disease, for example, having a jaundice. And for the precaution, a patient should avoid having any allergy or skin problems, abdominal or stomach pain, bloody diarrhea, train fever, because this symptom can cause a condition called mesalamine-induced acute intolerance syndrome, which is associated with mucosal inflammation. Thirdly is phenylketonuria fashion, because mesalamine contains a phenylalanine. And the last one is pregnancy patient.
Hello and a very good morning to everyone. So I will present about ciprofloxacin. It is an antibiotic that is used to treat bacterial infections. It stops the multiplication of bacteria by inhibiting the reproduction and repair of their DNA. So cipro used for many bacterial infections like skin infections, lung or airway infections, bone infections, joint infections, infectious diarrhea, and tract patient with fever, typhoid fever which caused by salmonella, cervical and urethral gonorrhea, chronic bacterial prostatitis, and acute uncomplicated cystitis. This is the picture for ciprofloxacin. Mechanism of action and side effect will be explained by KHALIS. So certain infections should not be treated by ciprofloxacin, which are uncomplicated UTI, acute bacterial exacerbation of chronic bronchitis, and acute bacterial sinusitis, because the patient will have a serious side effect. Ciprofloxacin should not be taken by the patient which are pregnant or breastfeeding, because it may cause a negative effect to the babies. That was for me. Thank you.
Hello guys, here we are in the mechanism of action of ciprofloxacin. Ciprofloxacin acts by inhibiting DNA gyrase and topoisomerase 4, where both are essential in bacterial DNA replication, transcription, repair, and recombination. As we can see from the diagram, cipro, which is a broad spectrum of fluoroquinolone class, act by stabilizing DNA gyrase complex This causes the broken strands cannot be released and DNA replication is blocked. After that, broken strands are released, which then resulting in cell death. Okay, now let's move to the side effect of ciprofloxacin. There are three types of side effect, which is first the significant, such as irreversible tendinitis, tendon rupture, peripheral neuropathy, and others. Second is common, such as nausea, vomiting, diarrhea, and others. And the third one is potentially fatal condition, which can cause death, such as hypoglycemia, hepatic necrosis, severe hypersensitivity reaction, and others.
A very good day everyone, my name is AMIRAH and I'll be explaining about vedolizumab, or its trade name known as Entyvio. So basically, Entyvio is an immunosuppressant medicine prescribed for adult patients who suffer from IBD, which is inflammatory bowel disease, which consists of Crohn's disease and also ulcerative colitis. However, this prescription is only applicable if other medications do not work well with the patient. It is indicated to reduce the clinical effects and trigger remission of IBD. In addition to this, it aids the patients to stop depending on corticosteroids. Moving on to the preventive measures, people with symptoms of infection and background of recurring severe infections should be cautious before taking this medicine, as this can worsen and increase the risk of getting severe infection. Hence, people who are going through or about to go for immunization, especially live vaccines, should be cautious before taking this medication. Besides, people with liver problems and jaundice too should consider taking Entyvio as an option, as it leads to a rise in the amount of transaminase and bilirubin. Lastly, Entyvio may induce hypersensitivity and anaphylaxis, so it is best to stop using it if these conditions occur. So all these mentioned groups are encouraged to first consult the health professionals.
My name is FADZILLAH and today I'll be talking about the mechanism of action and the side effects of Entyvio. As we all know, the gastrointestinal tissue inflammation can be seen by the increased number of lymphocyte and inflammatory cells which invades the tissue. So the main cause of the inflammation is due to the interaction between alpha-4 beta-7 integrin and MEDCAM1. So to counter the inflammation, Entyvio will work specifically to avoid this interaction. The mechanism of action will start with the binding of Entyvio to alpha-4 beta-7 integrin, which will block the interaction between alpha-4 beta-7 integrin and MEDCAM1. This can be seen in the slide here. So hence, Entyvio specifically inhibits T cell migration to the inflamed tissue, so there will be no excessive migration of T cells. This means that the entry of lymphocyte will be blocked and the inflammation will be reduced. So moving on to the side effects of Entyvio. So the side effects can be divided into two, which is common and serious. So the common side effects include runny nose, sore throat, headache, joint pain, fever, fatigue, cough, flu, back pain, and rash. The serious side effects are divided into three. The first one is allergic reaction. Its symptoms includes troublesome breathing, itchy skin, flushing, and rash. The second serious side effect is liver damage. The symptoms include yellowing of the skin and the whites of the eye, fatigue, and stomach pain. The third one is infection. For those who take Entyvio, has increased risk of infection such as common cold or flu. So more serious infection may occur from this, such as tuberculosis or progressive multifocal leukoencephalopathy. So next, my friend will be talking about amitriptyline.
Amitriptyline is a type of tricyclic antidepressant drug which have anti-inflammatory activities to treat IBD patient. Next, mechanism of action. Amitriptyline inhibits the production of pro-inflammatory cytokine TNF-alpha, which is responsible for the inflammatory reaction in intestinal mucosa. So, this can relieve the inflammatory reaction in IBD patient. Mechanism is amitriptyline acts on NF-κB pathway and exerts the anti-inflammatory reaction. NF-κB are responsible in regulating immune response and inflammatory cytokine production, which increase the inflammatory activities in lamina propria mononuclear cells. So, by inhibiting the NF-κB production, it can reduce the inflammation reaction. Okay, the last mechanism of action is amitriptyline also inhibit phosphorylation of p38 mitogen protein kinase, which is responsible in inflammatory gene expression to produce nitric oxide and pro-inflammatory cytokine. This is because nitric oxide can induce the ROS, which cause intestine damage and prolong the development of IBD.
Side effect of amitriptyline is hypostatic hypotension, which is due to blocking of alpha-1 receptor. The second side effect of this drug is neuroleptic malignant syndrome, which is very serious side effect and very rare. The third side effect of this drug is tachycardia, and the last side effect is urinary retention, which is due to blocking of acetylcholine production. And the precaution of this drug is about the dosage. Inflammatory bowel disease patient usually given less dosage compared to mental disease patient. As you know, this drug is an antidepressant drug. So IBD patient need to conduct with the doctor about the dosage to prevent the drug toxicity, which can lead to coma and convulsion. Another precaution of this drug is this drug cannot be taken with other medication. For example, taking amitriptyline with ZIZWAN. This might cause a very serious drug interaction, which can increase the risk of having serious side effects, as I mentioned before. So that's all for amitriptyline.
Okay, now I will continue with corticosteroids. As you can see, there are two types of corticosteroids, which is glucocorticoids and also mineralocorticoids. The glucocorticoids will convert sugar, fat and protein stores to usable energy, and it will also inhibit swelling and inflammation. And for mineralocorticoids, it will regulate minerals like sodium, potassium and also hydrogen. It is acting mostly in kidney and also in salivary glands. Next, we are going to general use for these corticosteroids. The effects will start working quickly, and it is a short-term treatment to relieve moderate or severe symptoms. These corticosteroids also will help patients to enter remission more quickly. It can be consumed orally, rectally, and also through an intravenous line. Okay, this is the example of the drugs, which is the prednisone, methylprednisolone, which is the brand name would be Medrol, hydrocortisone, which the brand name would be Protoform and Cortinema, and also budesonide, which is the brand name would be Entocort and Euceris.
Hi, my name is Muhammad IZZAT, and next I'll be reviewing about the mechanisms of actions of corticosteroids. The mechanisms can be divided into two, which are genomic and non-genomic. The genomic mechanism starts when the small-sized corticosteroids penetrates into the target cell cytoplasm, and it will bind to the alpha-isoform receptor on the nucleus, which will translocate into the nucleus. It will then attach to the DNA and suppress the transcription, which will inhibit transcription factors for cytokines production, and eventually lower the release of pro-inflammatory cytokines. And as for the non-genomic mechanism, the corticosteroids will attach to the membrane receptor of target cell, like the lymphocyte, which will interfere the membrane's absorption of calcium and sodium, and eventually cause the dysfunction of the lymphocyte's receptor signaling and immune response. As a result, it will significantly decline the inflammation activities. Alright, next we'll move on to the side effects of corticosteroids. There are a few common side effects of corticosteroids. These include high blood pressure, diabetes, osteoporosis, thinning of the skin, weight gain, insomnia, and many more that are not listed in the list. As mentioned earlier, corticosteroids is only a short-term treatment. This is because long-term intake of corticosteroids will cause one to develop steroids dependency, causing the body to cannot differentiate natural cortisol and corticosteroid. So over the time, body will stop producing cortisol. At this stage, trying to stop the intake will cause flare-ups.